Hello, I'm Jonathan Morse, the Deputy Director of the Centers for Medicare and Medicaid Services, Center for Program Integrity. Joining me is Dr. Shantanu Agarwal, Deputy Administrator and Director for the Center for Program Integrity. Dr. Agarwal is a board-certified emergency medicine physician and Fellow of the American Academy of Emergency Medicine. He continues to work clinically both in academic and community settings and holds an academic position here in Washington, D.C. I'm pleased to be able to speak with Dr. Agarwal about medical identity theft, particularly related to Medicare Advantage and Part D providers. Dr. Agarwal, thank you for being here today.
Thank you. Glad to be here.
The Centers for Medicare and Medicaid Services pays approximately 1.5 million providers under the Medicare program, many of whom provide healthcare services to over 34 million beneficiaries enrolled in Medicare Advantage and/or Part D plans. As the Medicare program has expanded, we've seen an increase in the provider identity theft, which impacts Medicare plan sponsors and healthcare providers. Dr. Agarwal is with us today to talk about the impact of identity theft, how to spot it, and what to do about it. Dr. Agarwal, as we begin our discussion, can you tell me what is medical identity theft?
You know, this is a really important topic, and I think very important for physicians and other providers to be aware of. Medical identity theft is basically the theft and misuse or appropriation of a provider's medical identity for the purpose of false, fraudulent, inappropriate billing. Stolen identifiers can include things like the National Provider Identifier for a provider, which is the NPI. It can include their Drug Enforcement Agency information, state medical licensure information, or even tax identifying information. All of those things can form the basis of then inappropriate or fraudulent claims that come as a result.
So what are the primary schemes that we're seeing in Medicare Advantage and Medicare Part D as it relates to identity theft?
I think there's two basic schemes that we see using stolen identifiers. One is where the thief, the fraudulent person or entity, actually uses the stolen identifiers to bill as if in the physician's name, him or herself, as if the physician was actually providing those services. So an example there might be billing for an office visit for a beneficiary or patient using the stolen identifiers. A second approach is to actually use the stolen identifiers to order or refer for other services, say ordering a diagnostic test or a prescription. Those services were not done directly in the stolen identity of the physician, but are used to then generate other kinds of billing.
So with the 1.5 million providers in Medicare Advantage and Part D, what do you estimate is the magnitude of the problem?
Numerous payers do track stolen identities because they help us in our prevention efforts. CMS tracks these identities as well for both providers and patients. And what we have found is we track roughly at this point about 2,400 stolen medical identities of providers themselves. That includes different parts of the Medicare program, including the Part D or prescription drug program.
So as a practicing physician, have you been the victim of identity theft or know of other providers who have been the victims of identity theft?
You know, unfortunately, I've met numerous providers that have been victims of identity theft, some of them really experiencing the gravest consequences of identity theft. I personally, in my practice, have been caught up in the issue as well, but I think to a much milder degree, fortunately, than other victims of identity theft. You know, I remember an experience in residency when I was training in Philadelphia when I had received a phone call from a pharmacy that was actually from an outlying suburb. And they had gotten a prescription in my name for a patient for a Schedule II drug, but they were able to ascertain just from the way the prescription was written that it probably was not written by a medical professional. So fortunately they contacted me and we were able to deal with that situation very early on. You know, no prescriptions were filled and you know, I didn't have any subsequent issues. So that is a very mild form, but I have to say, you know, unfortunately there are aspects of this that can take on kind of much graver outcomes for providers.
So what kind of repercussions can providers face if their identities are stolen?
So again, it does sort of depend on the scheme that was involved or how billing was generated using the stolen identity. As I mentioned in the first type, where the stolen identity is actually used for billing in the provider's name, that can have consequences, including tax consequences, because of course to the federal and state government, those earnings look like true earnings, and so a provider would be on the hook to pay taxes on earnings that he or she really didn't get. You can also imagine that if there's a subsequent audit done by a public or private payer, again, the provider could be on the hook and be responsible for paying back dollars that they didn't earn in the first place. So there can be significant financial consequences for the provider. There's also other kinds of consequences. So, when services are billed that weren't really provided using stolen identities, that can affect a patient's ability to get appropriate services down the line because it might look like they already received those services. It also can significantly alter the kind of data that payers and other institutions have available because, you're clearly just messing with claims and sending in inappropriate claims using these stolen identities.